Hi, I'm Ola Landgren. I'm professor of medicine and I'm the director of the Sylvester Myeloma Institute at University of Miami in Miami, Florida. On April 10 of 2026, we have the 13th Miami Myeloma MRD Meeting. This is an annual meeting that we have had for several years, and we draw a big audience here every year. The Miami Myeloma MRD Meeting has focused only on MRD, but in different settings of the disease. This year, the first session will start off with focusing on smoldering myeloma, the role of deep and durable responses. The second session will move on into the space of the newly diagnosed multiple myeloma. And there are a lot of new data from different studies shedding light. Then we will have a fireside chat with the FDA. The FDA has recently released their new guidance document on MRD in myeloma, which is a consequence of the work that we delivered at ODEC in April of 2024, when they voted 12-0 in favor of MRD as an early endpoint for accelerated approval. We will then continue focusing on MRD in the setting of relapse and refractory myeloma. We will also talk about how MRD is being used gradually more and more as a tool to make decisions for treatment, how to step up or step down or forego different steps in the treatment. And lastly, the meeting will talk about new technologies for MRD tracking. We have been doing it in the bone marrow for quite some time. There are different types of approaches, immune-based, immunophenotypic-based assays, and also DNA-based technologies. But we also now have blood-based DNA or proteomic assays, and there are also imaging-based technologies. We will talk about all these new technologies, where they're going, where the field is going. A lot of important and very exciting data.